This weekend is Mother's Day, of course, a time to celebrate moms of all ages. But as we all know, the arrival of a new baby can bring many stressful challenges into a woman's life. The Centers for Disease Control says 1 in 8 new mothers experiences postpartum depression. Here to tell us more about these findings, Dr. Martha Walsh, the Senior Medical Director and Associate Chief Medical Officer for Blue Cross Blue Shield of Michigan. How are you?
I'm great. Thanks so much for having me, Michelle.
Thanks for being here. So 1 in 8, I mean, that is a significant number.
Yeah, it really is. And I think, if you look at it from a positive note, I think we're having more awareness that this condition exists. And I think that's a really good thing because with that awareness, people are more likely to seek treatment. And so that's what I'm really hopeful for.
Yeah, absolutely. Because it used to be called baby blues, and it wasn't really dismissed, but it wasn't taken as seriously.
Yeah, so I think it's important to kind of share with you the difference between baby blues and postpartum depression. Yeah. So it's really common for women to have what are called the baby blues, and that's like initially the first few days after they deliver and can last even up to 2 weeks after delivery. But those are just mild feelings of sadness and sometimes some crying episodes. But postpartum depression is really a more severe episode where women have, really more significant symptoms. So it can be really feeling very sad, frequent crying episodes, sometimes feeling worthless or guilty, not bonding well with the baby, which is a really important symptom that they sometimes have, not sleeping at night. So there's a lot of other associated symptoms with postpartum depression, and it's in its most severe form, women can have symptoms of wanting to self-harm or to harm the baby. And that happens in about 6% of women who have postpartum depression.
And so what are some of the treatments that we're talking about?
Yeah, I think the most important thing is to really monitor yourself or monitor your spouse or partner for all of these symptoms so that you're aware and that you seek treatment with your physician right away. And the treatments can be as simple as therapy or sometimes medications, but there's a lot of things that you can do to help with postpartum depression. So I think the most important thing is to seek care right away from your physician, and then they can really talk to you about what are the next best steps. But I think one of the most important things is your physician needs to check in with you regularly to make sure that you're actually doing okay. And so that, if things are worsening, that then they can progress that treatment as well.
Yeah. A separate issue then from postpartum depression is postpartum anxiety. Can you talk a little bit about that?
Yeah, and let me just say too, Michelle, that many times these two things go hand in hand. Sure. So it's very common for women to have both. But postpartum anxiety are really symptoms of irrational fears and excessive worry. And so you can see symptoms of that of, new moms not wanting to leave the house because there's a fear of something happening to the baby, or watching the baby at night for fear that the baby would stop breathing, or not allowing anyone else to care for the baby because they're afraid of what might happen if they're not taking care of the baby. So many times both of these syndromes go hand in hand, and the physician can kind of evaluate patients for both of these things and then recommend the treatment that's going to be most effective based on the signs and symptoms of both depression and anxiety.
And again, keep talking about it. That is so important, not just for your physician, but also to family members. Where can people reach out for more help if they think they need it themselves or for a loved one?
Yeah, so obviously we talked a little bit about reaching out to your physician, and that's going to be really important. I think you mentioned something that's so important, and that's really that many times when women have these symptoms, they don't recognize them themselves. They just feel sad, and so I think it's really important for the spouses and family members and support network of all women that just have had a baby, that you're monitoring them for these symptoms and have the conversation with them if you notice those symptoms that they're having. And then there's a lot of resources. So there's a nice organization called Postpartum Support International that has really great support for women that need this, but your physician can also connect you with a lot of great support resources.
Yeah, that's so important. Well, good. Great information. Again, like you say, we are talking about it more, so that is a very important step. Thank you so much for being here today.
Thanks a lot, Michelle.